A shocking reversal of firings for hundreds of CDC staff members raises urgent questions about chaos in public health decision-making. Now imagine the impact on our nation's safety. In a development that's both a relief and a red flag, reports from multiple sources, including the American Federation of Government Employees, AFGE, the biggest union for federal workers, confirmed that the dismissals of hundreds of employees at the Centers for Disease Control and Prevention, CDC, have been largely overturned. Let's dive into the details of this unfolding story, breaking it down step by step so even newcomers to political and health policy can follow along easily. It all started with the announcement from the White House Budget Office on Friday, linked to the ongoing government shutdown. For those not familiar, a government shutdown occurs when Congress fails to pass funding bills, forcing many federal agencies to halt non-essential operations and sometimes leading to what are called reductions in force, or RIFs. These are systematic layoffs aimed at cutting costs during budget freezes, affecting various departments. In this case, the shutdown prompted the initiation of RIFs across multiple agencies, including the Department of Health and Human Services, HHS, which oversees the CDC. Initially, an HHS spokesperson explained that all employees receiving layoff notices had been classified as non-essential by their own divisions. But here's where it gets truly shocking. Over the weekend, the administration backtracked on more than half of the 1,300 termination notices sent to CDC public health experts. Based on insights from insiders shared with outlets like Axios and Reuters, around 700 people were reinstated, leaving approximately 600 still out of a job. This isn't just numbers, it's about real people dedicated to protecting our communities from diseases. And this is the part most people miss. These reversals highlight specific teams that are crucial to our health infrastructure. The New York Times detailed how, to put it simply, these are the frontline warriors who track and respond to threats like viruses and epidemics, and their work directly saves lives. The Times also reported that initially, about 70 EIS members faced layoffs, along with key figures like Athalia Christie and Maureen Barty, who were spearheading the federal fight against a recent measles outbreak. Measles is a highly contagious disease that can be prevented with vaccines. But outbreaks remind us how vulnerable populations can be without swift expert intervention. Christie and Barty were fired, only to get an email the next day rescinding their dismissals, dated around October 10th. A senior official in the administration admitted to the Times that these firings were errors, claiming incorrect notifications were sent and that any issues had been fixed. Meanwhile, a federal health official told ABC News it stemmed from a coding error, which sounds like a technical glitch in the system used to determine who stays and who goes. Neither the White House nor HHS has yet responded to requests for more details on the exact number of recalls. But here's where it gets controversial. Critics are blasting this as more than a mistake. Greg Gonsalves, an epidemiologist and part of Defend Public Health, a group of volunteers pushing back against what they see as harmful policies, called it an assault on the health and lives of every person in the U.S. He questioned the administration's diligence. Did they not care enough to find out who they were firing and what they did before sending termination letters? It's a fair point. Imagine if your job depended on such hasty decisions, especially in a field where precision can mean life or death. The carelessness here is staggering. And it begs the question, is this truly an oversight or a sign of deeper issues in how public health is managed? Adding fuel to the fire, the AFGE has sued the Trump administration to halt firings across all agencies. Court documents reveal that these layoffs could hit over 4,000 federal workers overall. Later this week, a judge in San Francisco will review arguments in the case, potentially setting a precedent for how such decisions are handled. This incident isn't isolated. The CDC has been rocked by turmoil lately. In August, a tragic shooting at the agency's Atlanta headquarters left a police officer dead after a gunman fired hundreds of rounds, blaming depression and suicidal thoughts on the COVID-19 vaccine. Then, Health Secretary Robert F. Kennedy Jr. dismissed CDC Director Susan Moneres after just under a month on the job. Her firing has sparked heated debates, with Moneres testifying at a Senate hearing that Kennedy removed her for refusing to align with his vaccine policies, even labeling the CDC the most corrupt federal agency in the world. Following this, several top public health leaders resigned in protest against what they viewed as political meddling. Former CDC Chief Medical Officer Deborah Howry echoed this, stating that Kennedy's censored CDC science politicized its processes and stripped leaders of independence. Dimitri Daskalakis, who once led the National Center for Immunization and Respiratory Diseases and was among those who quit earlier this year, summed it up poignantly on social media. Think about what it's like to be at CDC. It's like living with an abusive partner that attacks and then takes back some of the abuse. That doesn't make the partner less abusive. Sending strength to CDC staff held hostage. He added, CDC damage is done. Rescinded firings or not, U.S. health security is compromised. This perspective paints a picture of an agency under siege, where reversals feel like temporary reprieves rather than true fixes. So what's your take? Do you see these firings and reversals as innocent errors in a chaotic system, or evidence of a troubling disregard for science and public health? Is the administration's approach strengthening or weakening our defenses against diseases like measles or future pandemics? And could this be part of a larger pattern of political interference in non-partisan institutions? Share your thoughts in the comments. Do you agree with the critics, like Gonsalves and Daskalakis, or do you think there's more to the story? Let's discuss.